functional medicine is actually a combination of, you can say, nutrition, medicines, and Ayurvedic. So it's an integrative approach while we deal with the chronic health conditions in India and around the globe. So I say functional medicine is actually not an alternate science. It's basically foundation science where we look at patient's condition and we treat a root cause of that condition and we make a personalized approach for that particular patient. And that make a huge difference in patient's outcome. And that's what the functional medicine is stand for.
Right. So, one of the misconceptions related to functional medicine, or at least people around me and I also had at some point, was that functional medicine is more towards the supplement side rather than diet and other approaches. It's mostly supplements upon supplements is the misconception. So, would you like to clear this up?
So as I mentioned, you functional medicine is not just a prescribing a supplement. So when I take, let's say, give you a simple example of how I treat the patient from functional medicine approach. So when patients comes to me, I look at complete holistic approach to collect all the information of the patient. I will look at their diet, I will look at their supplements, I will look at their nutritional status, and then also I look at the root cause. I want to find out the root cause of that particular patient. And then nutrition is a one aspect to treat the patient. As I mentioned you, the functional medicine is a foundational science where nutrition is a one part, not a wholesome part. And that's the misconception people are carrying that, you go to some doctor and they prescribe a bunch of supplements to your patients. And that's a misconception actually in a functional medicine. So we like to treat the patient and diet. So food is not an supplements for that patient, and food is not a replacement of a nutrition. So we have to take a nutrition primarily from the diet itself. Why we need supplements? The question should be there. Why we need supplements? If our diet is sufficient in all the nutritions like vitamin D, B12, magnesium, all these things, why we need supplements? So in our approach, we deal with the nutrition and supplements, but that's the initial part. When the patient having too much deficiency of vitamin D, yes, we would like to correct that deficiency using a supplement, but that's a one point. And then our goal is how we can shift the patient to a nutrition diet where they can get vitamin D. Let's say, what is the source of vitamin D? We should teach the patient to go in the sunlight and get enough vitamin D2 in their diet. If there was sufficient vitamin D2 and there was sunlight exposure, they can readily convert their vitamin D2 to active vitamin D3. So it's not just about the supplements. Sometimes changing a lifestyle, changing a diet, they make a huge difference in patient life. Let's say another example is vitamin B. So do you know that we all know that vitamin B12 is not available in a vegetarian source. So if we consider that data, and if we look at the vegan patients, their vitamin B12 should be zero theoretically, but you will not find out any patient on the earth that vitamin B12 level is zero. So my question is, if the vegetarian diet doesn't have vitamin B12, then how this vegan patient is getting vitamin B12? Now, if you look at the science, then you can find out that gut microbiome produces vitamins. So if you correct your gut microbiome, right, you will get in this nutrition. So rather than putting a patient on long-term B12 or a B complex or other nutrient, why don't we focus on something on patient lifestyle? Why we create some kind of probiotic in their food, like already in our Ayurvedic medicines and our old ancient wisdom, we already eating the achar in our diet, pickles and achars, and so many fermented food was there in our diet. If you look at our ancient diet, but because of modern lifestyle, we had omit that. And now our diet is most often a carbohydrates and sugar and artificial substance. So it's not just really making it doesn't make a sense to put a patient on a rest of their life on supplements. Supplements are useful, nutrition are useful, and we have to correct that. But that's a therapeutic approach. And then when we put the patient on a maintenance, our primary focus is to enhance their food and teach their food how they can make an fermented food, how they can make their healthy gut microbiome, and that make a huge difference in their metabolic processes. So yes, you are right. There's a misconception because many doctors or practitioners who actually prescribe supplements don't look at the whole sum of functional medicine foundations, and they just prescribe the nutrition supplements. But is functional medicine not just in supplements? We want to find out the root cause of that particular patients, and whatever the nutrition they are deficient, we have to correct that. That's important. But that's not the only thing we are doing in functional medicine.